As companies across the U.S. see plunging demand from 2 months of economic shutdown and sky-high unemployment, investors are finding comfort in digital health, where the transition to remote services is happening at warp speed. From telehealth to remote monitoring tools, publicly traded companies and venture-backed businesses are experiencing surging growth, aided by an insurance industry that's now paying for its customers to use non-traditional services while they're sheltered in place. Hospital systems are reporting massive spikes in virtual visits. Ochsner Health in Louisiana, one of the coronavirus hotbeds, said it's conducted more than 120,000 virtual consultations so far this year, compared to 300 in all of 2019. Things that were 10 years away are now here, said Jake Dollarhide, CEO of Longbow Asset Management, which owns shares of Teladoc, a provider of remote healthcare. As companies question, do I need a permanent office or is large an office, they're also going to say, how do I save on health plans? Since the stock market peaked on February 19, the S&P 500 has fallen 13% as of Friday's close. Over that stretch, Teladoc has climbed 48%, while digital health management company Livongo has more than doubled. One Medical, which offers in-person and virtual services, has jumped 52%. Privately held companies are thriving as well. Teladoc competitor American Well, Amwell, just announced that it raised almost $200 million in private capital, and Omada Health, which helps patients manage chronic disease, just pulled in $57 million. Virtual mental health is another hot area. MindStrong announced a $100 million financing this week, after LifeStance pulled in $1.2 billion in April. What we've seen with COVID is it's been the catalyst in many ways for people to rethink lots of different areas of life, and access to and delivery of health care is one of the first and foremost, said Brian Cuneo, global co-chair of the Life Sciences and Healthcare Group at law firm Latham & Watkins. We're seeing a ton of innovation and a ton of capital pouring into these markets. Hospitals and clinics are focused on keeping patients safe at home while also delivering adequate treatment. The Centers for Disease Control and Prevention recommends that people who suspect they might have COVID-19 coordinate a telehealth visit before going to the emergency room, where they risk exposing others. At the same time, governments are relaxing rules that made it challenging for telehealth companies to grow. For instance, several states have made it easier for doctors to practice across state lines without requiring additional licenses, and the federal government has agreed to reimburse doctors equally for virtual and physical visits. Steve Krause, a partner at Bessemer Venture Partners who's been exploring the health tech space for more than a decade, said that it used to be a Sisyphean task to move telemedicine forward. The pandemic has changed the landscape.